Hello, it is good to see everyone with us here today. I have a fellow health and wellness enthusiast with me here today, Kimberly Albarran. We met through a company that we both work for that we're so inspired to change people's lives and help them to be healthy. And, this is something that we all just struggle with being healthy and on so many different levels. Kimberly is a physical therapist out of Prescott, Arizona. She has been practicing since 2013, and her primary focus is to specialize working with individuals with chronic and persistent pain. And along the way, she found additional passion within the health and wellness and becoming a certified health coach and personal trainer. That's awesome. So much of this it's so interconnected. And her mission is to inspire healthy living, help clients find hope for their health and healing, and to become advocates for their own well-being. Oh, I just love that piece there, Kimberly, too. And using her 4 pillars of health, and I'm going to ask you a little bit more about those too, but I want to welcome you, Kimberly, and thank you for joining us today.
Thank you, Peggy, for hosting this interview. I'm really excited to share some information, and hopefully I can add some bits and nuggets that people can take away from this and start really focusing on themselves and healing.
Yeah. Well, awesome. So one of my first questions, because I'm in the Denver area and you're in Prescott, and we met through a mutual company, but as we were talking, I'm so intrigued for the fact that you can actually work with people virtually, that they do not have to be in your same area. Tell me a little bit about that.
Yeah. So I can work virtually online doing Zoom consultations, Zoom physical therapy, and wellness consultations sessions. And I also do meal planning. I'm in the process of finishing up my functional nutrition course, which is geared and specialized towards chronic pain research and nutrition, and looking at how can we create an anti-inflammatory diet that helps to reduce that inflammation that contributes to pain and have overall balance and well-being. So I can design meal plans, and we can do one-on-one coaching sessions, or we can do it where it's more of an online program where I create the meal plan and we do weekly check-ins just to make sure that the food recipes are on the right track with what individuals can tolerate and that they're enjoying them, and overcoming obstacles and creating strategies for being able to really be successful with these programs.
Oh, that's awesome, because not only do we have the nutrition component in common, but I was also a certified personal trainer for 12 years. And, at that time, Zoom wasn't so much available, and doing things was more like in person. So it's great that you can design that so that they can take that and move it forward. That whole concept. So that brings me around to what you're talking about, your 4 pillars. I didn't tell our audience about them. So tell us a little bit about what those 4 pillars are and how they're integrated into what you do with your personal training and your physical therapy and just all of this.
Definitely. Well, when we look at individuals that have chronic pain, a lot of individuals are really having difficulty, understanding how things that they're going through are interacting with their body. And our medical system, we try to really help people by figuring out what symptoms are and then the cause to those symptoms, but we don't really help them understand in totality of how maybe their emotional state is affecting their internal physiology, how what they're eating really can cause inflammation or, prevent inflammation or reduce that inflammatory response. So what I look at are 4 pillars. We look at nutrition, what things are beneficial for each individual and what things may be contributing to their pain and inflammation. We look at mindset and mindfulness, because a lot of individuals, whether anxiety and depression came first or it comes after the chronic pain sets in, there's a lot of stress. There might be stress within the family, there might be stress at work, there might be, a trauma that took place, and that emotion from the trauma is still you know, in their mind, in their body. And so how do we calm the mind in order to calm the body so that it's not as overreactive to stimulation, noise, things that we're seeing, things that we're hearing. Those things interact with our emotional centers in our brain. And if it sends out a signal to the brain that it's a warning, then the brain becomes more sensitive to feeling pain throughout the body, whether it's really a tissue issue or the brain's perception of what's going on. So we want to work through mindfulness. And then we want to get people moving, because a lot of people, when we're in pain, are not moving. We want to protect that body part. We start to move and we have pain, and our brain goes into that, you know, mode of, I need to protect myself. This is hurting. Am I injuring my tissue further by causing more pain when I'm moving? And it's working through those things and teaching people that movement is okay, and getting the brain to say, hey, this isn't so bad. I'm okay with what's going on in my body right now. And again, easing that response. And then sleep. So many people with pain, or just a lot of Americans in general, we have so much difficulty either going to sleep or staying asleep. We're bombarded by electronics, which mess with our internal hormones, sleep hormones. And when we're not sleeping well, we are not able to produce the energy that we need, and our cells and tissues cannot heal and repair. So again, we have more inflammation, and we also have cells that maybe are not working as well as they should be. So there's, you know, dysfunction within the body of not being able to, you know, do the things we need. It would be like the car running out of gas. Essentially, it's sputtering and eventually it stops. Right? So if we think of our bodies as a vehicle, the foods that we put in our bodies, the thoughts that we put in our mind, the way that we're moving, and the way that we're sleeping or not sleeping really affects our overall ability to function and handle the things that we need to do on a day-to-day basis.
Mm-hmm. Wow. Thank you. So really intrigues me when you talked about the emotional state and, you know, what comes first, the trauma or the depression or the anxiety. And so I wanted to dig into this a little bit deeper, because working as a grief coach, that's one of the things I find, that people start to see pain, onset of diseases after they've experienced this trauma. And so how that emotional state's affecting the physiology. And can you relate that a little bit more to grief?
Definitely. So yeah, when we're under extreme amount of stress, especially if it's, you know, say like maybe it's a terminal illness or something that we know is, you know, coming, and we're just doing whatever we need to for that person. Like I lost my father 12 years ago, and, you know, in the hospital, it's very stressful. You know, you're trying to get answers, and the physicians don't quite know, like, if do we need to keep them on the main floor? Are we going to send them to ICU? Is this person going to survive? And so, you know, that starts this cycle of, you know, we got to make sure paperwork is in order, and we're just not thinking about ourselves. We might not even be taking as good a care of ourselves. And I know my sister and I, we were running around and eating Del Taco and taking care of paperwork. And it was like, you know, the stress, the amount of cortisol that starts to build up in our system. And cortisol is not necessarily a bad thing. We need it for energy. Our cortisol rises in the morning, but when we have prolonged levels of cortisol over time, then our immune system starts to become suppressed, and we start to have higher levels of inflammatory chemicals that can circulate through our tissues. And sometimes it goes generally to our tissues. We start having muscle pain and joint pain. Our muscles are tense. When our muscles are tense, we don't get good blood flow to those muscles, so we can't produce energy. Our tissue changes the pH of it, so it becomes really acidic, and that's when we start to feel kind of that achiness, and sometimes burning. The pH changes can irritate our nerve endings, and then our nervous system tolerance to things actually decreases. So the nervous system starts to become more sensitive. Our brain becomes more aware to stressors. So we become more stressed out or agitated, or, maybe the stress becomes so much that we want to just, hide out away from what's going on and hiding out away from the world. And so our system starts to become a little bit more depressed. We have changes in our neurotransmitter production, those feel-good hormones, the serotonin and dopamine. We might not be producing as much of our own endorphins or opioid type chemicals in our brain. And so our system's not as good at modulating pain. So, it's things that, normal touch can become more painful and sensitive because the nervous system is just hypersensitive and it's perceiving everything as a painful stimulation. So yeah, I think sometimes it can just be being on that roller coaster of life. And then, I know for me, after it's like the passing of my father, or it might be after everything's over. I know you've talked about like, after the funeral's over and people are, back at their own home, and you're left with like, this is my life now. Like the reality kind of just hits you like a brick hitting your head, and you're left with all these emotions, and how do you survive? And you've been up at this level dealing with everything, and now your body just crashes. Maybe you're in adrenal fatigue. You're again, the brain becomes out of balance, maybe not sleeping well because you try to go to bed and you're crying, or you're just thinking about whatever the person that you lost, or the emotions that you're left with of how could I have handled this better? Is there anything else that I could have done? And so then the sleep pattern then starts to change as well. So that's when we start to see these physiological changes. And for some people, it's, it could be days, weeks, months, years. I've seen patients who have, I swear they have broken heart syndrome because they're taking care of a loved one with a chronic illness, and it's not getting better, but their life becomes so much about taking care of the other person that they're so distraught about that's the way their life is going, or they're just not taking care of themselves. And so we start to see some of these underlying chronic conditions. It could be cardiovascular conditions, because stress and cortisol put a lot of stress on the heart. We can start to see, things like cancer, chronic pain, autoimmune conditions, whether it's rheumatoid arthritis, or they call it an idiopathic autoimmune condition where the immune system is out of balance, but they really don't know why. There's not a label that they can put on it, but the system is out of balance, and the immune system starts to attack the body and the joints.
Yeah, wow. Well, because I do hear of so many people being diagnosed with non-immune disease so suddenly after experiencing trauma. And so you mentioned the broken heart syndrome, and that is becoming more and more recognized among physicians because of the impact, the physiological impact that loss, that grief has on a person. And the heart is one of those bigger organs. I mean, there's other organs that are associated with that, but that is like the breathing and that literal pain that they experience with that. So yeah. So you talked about movement, and that fear of movement resulting in pain. And so if somebody comes to you and you're prescribing, get moving, how do you encourage them to rethink that? Because you talk about the mental component. If I came to you and said, for example, I've lost my son, and if I came to you and said that my whole body just is terrible, achy, and it hurts when I move, so I lay in bed and do nothing and I still hurt, how would you encourage me to get moving? What tip would you give me to say, hey, you'll be okay?
Definitely. Yeah, it really depends on the person and their level of anxiety. So really what I do first is I work with the individual with I do like mindful meditation, mind-body awareness, and diaphragmatic breathing. Is we need to retrain the body how to breathe, get that oxygen in, and to relax, because a lot of people come in and they have a lot of tension. And so if I'm working with them online or virtually, yeah, I'll just have them lie down. We'll go through a body scan and really get the mind connected with the body again. And it might be even just doing a gentle contraction and then a relaxation, contraction and relaxation. So we can tell the brain that it's okay not to be tense and protective. And when we breathe, so going back to the broken heart syndrome as well, is we have a large nerve in our body called the vagus nerve, and it's highly tied into our mental state and anxiety. So we have our rest and digest part of our nervous system and a fight or flight part. And the vagus nerve has it sends signals to our heart, it sends signals to our diaphragm, it sends signals to our gut. So if we can get that part of our vagus nerve to be more in the rest and digest, then that will actually start to calm down the brain as well. And it will help improve our heart rhythm. It will help improve our digestive processes. Because a lot of people can become constipated or, have kind of an irritable bowel issue where they're constipated or having diarrhea. So that's the first thing. If someone is really apprehensive about moving, is we need to just calm down that nervous system. And then it might be lying down and it might be wiggling our toes. And does that feel okay? And if that feels okay, then it might be going into doing some gentle ankle pumps. And then just moving the knees, bending and straightening the knees. So we're going to start off really, really gentle and just re-engage. I always say the brain loses its ability to sense where the body is in space, and that the brain then turns its radar up for the body. And that could be another reason why we are starting to have pain, is because the brain's like, I don't know what's going on and I don't know where you are. I don't know where you're moving. So those gentle movements, then it's like, okay, how does that feel? And really engaging, taking time to think about it and process the process of moving and being okay with moving, right? We move on a regular basis. We get up, we go to the bathroom. So then it's from there we build on, like, let's get up and walk around the house, maybe for 5-10 minutes, or go outside and walk out the driveway and see if you can make it to the mailbox and back. So it's very short bursts. And then it's progressing them to where then we can do more of that personal training type of thing, where we're trying to do functional movements, squats, lunges, but it might even be we back off, we do gentle stretching. So I say movement because when a lot of people hear exercise, they think, oh my God, it's going to be painful and she's going to hurt me and she's going to make me do all these things. But when I've asked clients, I say, when I say movement versus exercise, how does movement make you feel? It's a much gentler word than exercise, because exercise for a lot of people is like, I'm going to be doing jazzercise and I'm going to have to go out and run. And it's really not even about that. It's about just getting people to move, and this might be the movement, or this might be the movement, and then starting to reach across, so we're moving the ribs and things like that.
Wow, I really like that, in starting with making that mind-body connection, because I think body awareness is something in general that we lack. And then when you're in a state of grief and trauma and stress and anxiety, that your brain doesn't know where it's going. So I really like that, really stripping it down to really the basics, even further in creating that connection. I think I really like that you do that, and allowing them to start to feel and recognize where they are. So I think that's absolutely amazing. Yeah. And so sleep, You mentioned that we have tendency to not get the sleep. And I know that coming from my world, that it's something I call sleep hygiene. And I was wondering if you could speak to that and how, maybe talking more specifically about technology and sleeping and what kind of recommendations you have for that, because it's when we're sleeping is when our body repairs, that all the other functions that shut down, but getting to that point of being able to sleep. So talk to me a little bit more about the sleep hygiene and technology.
Yeah, definitely. So if I'm working with an individual that has chronic pain, I'm looking at how often are they on their cell phone, playing games, right? Not only for the component of the blue light. I think most people by now probably have heard, these I have blue light blockers on my glasses. And so blue light is associated with the sun. When we receive input from the sun, those blue wave spectrum, that goes into our eyes, and we have receptors that then go up to our brain to tell our brain that we need to be awake. So the main light, even though we see it as being white, is in the blue light wave spectrum. And so if at night things are supposed to be dark, that darkness starts to stimulate our pineal gland, which is responsible for making our melatonin. Serotonin is a precursor to that. So if we are having anxiety or depression, our serotonin levels may be low. So maybe we're not even able to produce enough melatonin to get into that relaxed state. And so sometimes what happens also is that the cortisol melatonin signals get confused. So we have more cortisol at night and more melatonin during the day. So people that have difficulty sleeping at night may be more wound up. Our brains like, we need to be awake right now. And then we kind of crash in the morning and we're tired, we're fatigued because we still have a higher level of cortisol coming down, and then we produce maybe more melatonin during the day. So it's our circadian rhythm then goes opposite. But sometimes we don't have enough of those precursor neurotransmitters or neurohormones to even make the melatonin that we need to sleep. So that's, if we're, sleep doctors and research recommend, getting into a consistent routine. Being in a routine helps our brain anyways know what to expect and know what to do. So we're not in that chaos of, okay, well, what am I supposed to do now? Where am I going? And then we just get more stressed out. So, going to bed at the same time every night, waking up at the same time every day can help with resetting that circadian rhythm. There are supplements. Melatonin is one. 5-HTP, which is actually tryptophan, is a precursor for serotonin, which then can help build up serotonin and then produce more melatonin. Because I know for some people, the melatonin doesn't necessarily work as well. And then there's another supplement called GABA, G-A-B-A, and that's another, we call them inhibitory or excitatory neurotransmitters. So those things can help with increasing more serotonin. Now, if someone's taking an anti-anxiety medication or an antidepressant that helps with leaving more serotonin in the brain, these are things that you would want to speak with your physician about before starting to take, because if you have too much serotonin, then that can cause other problems like agitation, dizziness, nausea. But there are natural things that we can take to help our body function better. CBD is another one. But really having that schedule, when we talk about sleep hygiene, I talk about that. And then I also ask my patients or clients if they have a TV in their room, are they taking their cell phone into their room? Because if there are, with the routers, there's frequencies being transmitted. Michael Brewis, who's a sleep doctor out of Scottsdale, Arizona, has done research on looking at the frequencies that are being transmitted from a router to your device and how they can actually interrupt the brain waves. So delta waves are deep sleep waves, and how they can actually interfere with our brain being able to produce these brain waves as well. So, you know, turning your Wi-Fi off if you're going to have your cell phone as your alarm clock. I really recommend people do not have TVs in their room, watching TV before they go to sleep. Oh, but it helps me go to sleep, that noise. It's, you know, get a little fan or a noisemaker or something else that can calm the nervous system, because if there's wireless signal being transmitted to that TV in the room, or again, that blue light, you hear a noise, you're having interrupted sleep. I've had clients tell me, yeah, Kimberly, I turned the TV off and I did sleep better. It might take a few nights to, you know, kind of cycle back. And if it's still a problem, that might be where, you know, having a sleep test done to see if there's, you know, something else underlying that. Maybe there's some breathing issues or whatnot, but that can come from stress too, because, you know, our breathing is regulated by our brain and brain stem. And if there's signals that are not being, you know, sent correctly, or again, we're more anxious and we're having those higher cortisol levels. But a sleep professional will be able to help talk you through those things and kind of determine, well, maybe this is really more anxiety and we need to work on some strategies for that, versus, yeah, this sounds like it may be, you know, a sleep condition. Let's see, do we need to do further testing and maybe get you on a CPAP or a BiPAP where you're getting more oxygen, because that can make us feel tired and drowsy and things. If we're not getting good oxygen to our brain, you know, our brain cannot function without that oxygen.
Yeah. So I liked your list. Was that 5-HTP, melatonin, and GABA? Did I get those correct? That are the precursors for the serotonin. Along with that, I do like the fact that you recommend that you consult with your physician to really see where you stand on that. So how would somebody, you know, talk to their doctor, and then how would a doctor determine your levels of these and make a diagnosis and recommendation?
Yeah, you know, really depends on the physician. If they're knowledgeable about supplements, sometimes they're not. So, you know, there is research that talks about these supplements and where, like, what level you should start. So if I'm working with a client, they're not taking like an antidepressant or an anti-anxiety medication that helps with increasing serotonin, I'll usually start them at like 50 milligrams of the 5-HTP. Just to make sure and see how they do. I haven't really recommend GABA as much as the 5-HTP. If someone's tried melatonin and it doesn't work, but there are, you know, melatonin takes a while to build up in your system. So, you know, again, at 50 to 100 milligrams, I'm trying to think of the melatonin is different than the 5-HTP, but usually starting with a lower dose and then gradually going up. So,
okay, so is there like a blood test that is done to determine what those levels are, or do you just like the signs and symptoms that you're not sleeping and then go, okay, let's go ahead and give these supplements a try?
Yeah, I would say it's usually try the supplements first. Now, if someone is really having an issue sleeping, they've tried everything, there are blood tests that can determine your neurotransmitter levels. So they can look and see, is it really low? Is this something that we need to be medicating for? Maybe they need a higher dose. But I don't know how common it is really to test for the neurotransmitters. I would say, you know, your general blood test is what's going to be first. But yeah, I think really just the thing about being a physical therapist, compared to being a physician, is that, you know, physicians are really wrapped up in this time constraint. And so, you know, they're just treating symptoms. They're trying to do the best that they can to, you know, help the patient that's in front of them. But it's really about talking to somebody about what their habits are and really getting into that mindset. And again, it may be working with someone like you as a grief coach to help them if they're grieving the loss of a child, or they may need some different, if it's like a PTSD or a trauma that had happened, they may need more intensive therapy to really help change the brain and the way it's processing the information that's coming in. So it's really about just talking to somebody and finding out where they're at. The more you can find out about someone's history and past that they come with, or even what's happening currently, the more that we can really help somebody. I think that's what it's about at the end of the day. And I think if we can feel heard and listened to, I mean, as a healthcare provider, when I go to my physician, I want to be heard and listened to and acknowledged. I don't like medication. I want an alternative way of figuring something out. So I at least want that to be acknowledged and not to continue to push whatever the agenda is, whether it's pharmaceuticals. So at the end of the day, for me, it's listening to where somebody's at, letting them express themselves and be who they are and share what's going on. Like, you know, for me, the whole history, if someone fell out of a tree when they were 7, that can have an impact on their neck. It may not impact them as a child, but as we age and our tissue structure changes or our neurological processes slow down, then we might start seeing more of these dysfunctions as we age. So it's really all important. If someone was abused as a child physically or, you know, sexually, those things are really important because those emotions and those traumas stay in our body. They go to different organs and they change the way that our nervous system processes things, maybe the way our eyes move and stabilize on our environment, and our balance is off and our coordination is off. Those things contribute to pain as well. So we need to figure out what has happened, and hopefully someone's able to share with us and be open and honest about those triggers and traumas and things that have happened in their life.
So you really get to know your clients and intimately getting to know them well. So I think that's the holistic approach in which you see them as a person, and rather than just the injury which they're complaining about and saying, you know what, my hand hurts, and instead of just focusing on that hand, you ask the other questions and look at these other things. How are you sleeping? You know, what are your patterns and habits? One of them that I personally love and is the nutrition component. And what is the biggest thing that you recommend that somebody really try to reduce in their diet that's such an inflammatory?
Definitely. Yeah, sugar is, I would say, the number one thing. The second thing would be inflammatory oils. And we're getting those in a lot of our prepackaged and processed foods. And even some of these healthier, you know, prepared meals, you know, they have canola oil or soybean oil in them. And, you know, if you eat one meal like that, it may not have an effect, but over time, these inflammatory oils, you know, it's again, if you have a turbo powered car that needs 91 octane and you put, you know, 87 in it, it's not going to run the same way than if you put 91 octane in it. So I really, when I work with clients too, because some people are like, well, I really have to have this. So I try not to take things away so much as let's add some healthier options in there. But it's teaching people how to read food labels and having an understanding of, you know, when they start eating healthier foods, they're like, wow, I feel really good. I'm not as hungry. So their blood sugar's more stable. And when they do then eat those sugary foods or processed foods, they're like, oh my God, my gut hurts. I'm like so sick. I have so much pain. So again, it's really just bringing it back to that awareness and mindfulness, and also working on strategies, right? Because when I'm bored, I'm not gonna lie, I'm looking in the refrigerator like, what can I eat? Because I'm bored. I'm just like, what can I do right now? That's where having a schedule comes in. But it's looking at when I get anxious, if I use food as a strategy for coping, what is a healthier alternative? What's a healthier strategy? So I'll work with the client to see what works for them, but it might be going into the room and meditating and breathing and just changing the brain, changing that anxiety. because when we have high levels of cortisol, it changes our blood sugar levels. We have high blood sugar and then it crashes, and high blood sugar and it crashes. So that's when we're like, I need sugar right now. I just need to eat whatever I can eat. So it's how do we stabilize the cortisol levels so that we're not having those blood sugar changes. And then I love to add high fiber foods. So, I encourage smoothies in the morning, and, meal prepping. So crock pot meals. So people aren't having to prepare a meal for breakfast, lunch, and dinner. What are some healthier alternatives for snacks that I can just go grab, that I don't have to necessarily cook something, because if I don't feel good and I can't stand in the kitchen for more than 10 minutes, I'm not going to do your meal plan. So it's really meeting the people, the clients where they're at, and it's starting with simple changes. It might be, let's drink more water. If they need caffeine, like, can we go to green tea versus, how much coffee are you drinking? And then slowly reducing that caffeine intake. That has an impact on our cortisol and anxiety, and some people are more sensitive. So yeah, it's just looking at what's the one thing that we can change, right? It might even be adding that whole food nutrition supplementation. That might be one thing. It's easy to take a capsule or do a chewable and get some good quality in. So it depends on where people are financially and where they are emotionally and mentally, and where they're prepared to take those steps. But yeah, sometimes I do an anti-inflammatory diet, which usually I work on reducing sugar first, and then processed foods, and then dairy and gluten and things like that. And so, someone might be like, well, I need that piece of bread in the morning. So it's like, well, let's do that versus let's cut it all out and you can't have anything. And then that's not realistic. And people are like, I just don't know, Kimberly, I just can't do it.
Yeah. You mentioned sugar a couple times, and so in the grief process, it's really easy to crave the salts, the sugars, the processed foods. And so when you talk about that, I think so many times people think sugar, it's like, oh, I don't put sugar in my coffee. I don't put it in my tea or whatever. But, what is one thing, one area, just like one thing in helping to reduce the sugar, you would give somebody a tip to start with?
Definitely. I recommend that they switch to doing like maybe, I do non-dairy yogurt, but it might be, I have recipes where they're making like frozen banana yogurt, or kind of like these sorbets, and they're real easy. It's just fruit. And like I said, I usually have them do like a non-dairy coconut yogurt, and they mix it together and they put it in the freezer. And now they have, a natural sorbet versus going to the store and getting, the ice creams or sorbets that have 20 to 30 grams of sugar. Just, eat, or maybe go grab that, some blueberries and raspberries or strawberries, or half a banana. I know there's this craze about, oh my gosh, but fruit has so much sugar in it. And it's like, but when we look at the berries, they have so many nutrients. They also have fiber components to them, and lots of antioxidants that help with reducing inflammation. And we have vitamins and minerals in our whole foods. So those are things that we're not going to get in a processed food. But, it could curb the craving of wanting that sugar. So smoothies are excellent, just a little bit of yogurt and some non-dairy milk or coconut water and some fruit, and you have yourself a fruit smoothie, and that feels like a milkshake.
Wow. Okay. Yeah, I could have a milkshake for breakfast. Yeah, absolutely. Wow. So you have shared some great information here, and being able to work with somebody with all these different things, starting from something simple like, oh, let's just connect our body and really give our body permission to feel, or that we can start getting sleep and giving our body that opportunity to heal. And you offered some different strategies with that as well. And then, about the nutrition, saying that sugar is such a big culprit, and that it is just such an inflammatory with it. So wonderful information. And so if somebody wanted to say, oh man, I love what Kimberly's talking about, I really wanted to be able to connect with her, how would somebody connect with you, find out some more information?
Definitely. Yeah, so you can look me up on Facebook. Also, my phone number, reach out, is 619-808-3987. You can call or text is a great method of getting a hold of me. And my email address is hopehealthhealingforyou@gmail.com. So, call, text, or email are great ways to get a hold of me. Once you get a hold of me, I do have a jot form survey type of thing that I will have you fill out, or we'll set up a time to do a consultation, whether it's over the phone, or if you're, in another state, we can set up a Zoom consultation to really chat, get to know each other, and also make sure that I'm the correct person that you need to start with, because you may need additional medical care, and then to come back and start with me. But those are things that I can help kind of guide you and offer resources and what direction may help you to start off with the process.
Okay, awesome. So that they can set up a call with you, a Zoom, just kind of review what they've got going on, and you'll determine whether or not you can help them, or if they need to see somebody else first, come back to you, maybe work together, consecutively, not consecutively, together, simultaneously. Yeah. There we go. That's the word I'm looking for, that you could work with them simultaneously, and that, chronic pain caused from injuries, grief, the chicken before the egg, whatever that may have come. But the fact is that they're experiencing it, and you take that holistic look at them and see where they're coming from. Definitely. Yeah. So is there any last parting words of advice that you would like to offer regarding this chronic pain and what people are experiencing?
Definitely. Just know that you're not alone. This is something that really, a lot of people are going through something very similar, even though it may not look the same. I mean, 1 out of 3 Americans have chronic pain today. So just know that there are providers out there who understand, who listen, and can really help get you going. So you're not alone in this. Make sure that you find a healthcare provider that listens to you and that you can partner with based on what your goals and what your desires for your healthcare are. Because as a patient, because I am a patient also, we have the right to ask questions. We have the right to decide what we want to do. And so find somebody who's going to be on that team with you. And that's really what it's about. It's, sometimes I get stuck in my mind and I have an agenda of how I think things should work because of the way I learn things in school. But at the end of the day, it comes back to really what the client wants and desires. And I have the tools to help provide those things. But I'm not in anyone's body. And so, again, if something doesn't work for you, know that is okay. There is going to be something else that does, and someone else who can help you. And as a physical therapist, sometimes I'm not really the first person that should be seeing somebody because the system might be out of balance. But, I can help with those type of things because of the nutrition background. But just, I think know that you're not alone, that there's a lot of support out there for you if you're suffering with chronic pain. And just know that even though it's unfortunate we have so many people who are going through this, that there is hope and that you can feel better. You can have a life, you can do things that you want to do. It's just a process, and it may take some time to get back to those things. But that's why, I provide that hope that you can have health, and it's really about overall healing. That's where I came up with my business name, because really having hope is the first thing. Hope that you can feel better, hope that you don't have to live in this state for the remainder of your life. So I just want to really imprint that is that there is hope out there available for you, and someone is there to be on your team and help you get through it.
Yeah, well, amazing. 1 in 3 are in chronic pain. That's an amazing statistic. So folks out there, if you are one of those 3, please reach out to Kimberly. She has a whole encompassing skill set to take you from figuring out what's causing your pain to actually helping you to move through that pain and to get better. So I want to thank you so much, Kimberly. One more time, just give me that email address. I'll go ahead and put it into the description here, but for those who may not read the description, let's go ahead and just give them that email address that they can reach out to you.
Yes, so it's hope, health, healing for you at gmail.com.
Okay, awesome. Well, Kimberly, thank you so much for all this valuable insight. I appreciate you, and thank you.
Thank you, Peggy. I appreciate you as well, and we're going to help you all together.